How do people get cystic fibrosis?
It's a genetic disease. You get it if both parents have the gene, the abnormal gene. So they're, in other words, if they're both carriers. It's an autosomal recessive disease, which means you have to get both defective alleles of the gene from both parents.
How is cystic fibrosis diagnosed?
Do you want me to explain a little more about it before getting to the diagnosis?
Please go ahead.
Regarding your first question, it's a common disease. It's actually one of the most common inherited diseases that result in death, actually. It's the carrier, the incidence of carrier is about 4% in Caucasians, less common in other ethnic groups. So it means if two parents are both carriers, you'll have the disease. It results in about 30,000 cases in US. So it's not that common, but still it's one of the most common chronic and at the end fatal diseases. And okay, if you need more.
All right. Yes. How do you get cystic fibrosis?
That was how you get it. It's a genetic disease.
I was going to ask, how is cystic fibrosis diagnosed?
It's if there are different in different communities. It's different. For example, if there is a method in place, diagnostic method in place, starting with genetic testing of the fetus, or right after the baby is born, to do a series of tests, you can diagnose it within the first 6 months. But in communities when this system is not in place, it takes more than that until they start having lung infections typically, or other kinds of problems. It affects all organs, GI system, gastrointestinal, respiratory system, and endocrine, and so forth. So the best way to diagnose is to do screening. If both parents, or even one of them, is a carrier, to do the genetic testing in the other parent to make sure one of them is healthy, because if one of them is fine, you won't get the disease. It's an autosomal recessive, which means you need both sides affected. So after this is done and both parents are carriers of the abnormal gene, then it's better to do genetic testing directly on the baby. That's possible, but without going into the details. And if that step is missed as soon as the baby is born, there are different ways of knowing. For example, some parents report that the child is tasting salty, and that's a part of the disease, because their sweat has a higher concentration of chloride and sodium. In fact, sweat test is a diagnostic test, or that's one of the feasible ones. But of course, you can always look for the mutation in the gene. The difficulty with that is that there's about 1,000 different mutations on the same gene in different parts of that result in different abnormalities in the protein. But the most practical one would be sweat test.
Okay. How does it affect the lungs?
Basically, what cystic fibrosis does is it thickens the mucus secretions, from sweat to secretions in the lung or in the GI system or in the pancreas and so forth. So what it does, which is the main presentation, causes the main symptomatology of the disease, is it causes thickening of the mucus secretions in the alveoli, which is, you guys know what alveoli are.
Right. Small
spaces in the lung. So instead of leaving the membrane of the alveoli as an interface between air and blood, that thickened mucus would make the alveoli collapse. So, and also absorbs bacteria for infection. So chronic lung infection is at the end the deadly part of the disease. They have to be on antibiotics on a continual basis to prevent infection. In the past, though, people would die by age 6 months, babies basically. But about 50 years ago, it was as bad as that. But nowadays, the average and the survival is about in mid-40s. And many of them even finish college. I mean, more than half of them even finish college based on one study.
I was going to go on to ask, is there a cure for cystic fibrosis?
No, there's no cure, but there's treatment. And the fact that I just mentioned, their survival is increased from 6 months to 40, 50 years is because of the treatment of different conditions. Infections have to be treated and even prevented with antibiotics. If they have developed diabetes because of the involvement of pancreas, diabetes needs to be treated. If they have GI problems and so on. So treatment is available, but there is no cure.
What are some other possible complications as a result of cystic fibrosis?
Besides the lung, I mentioned diabetes. I mentioned also the same thing happens to the pancreas, and then they develop a special form of diabetes.
So it's the mucus that is affecting all
again the
regions
same way. If you are interested in exact mechanism, first of all, it's not very well known, but we know that because of the abnormality in chloride conductance across the membrane. This is one theory. There is abnormality in the concentration of the mucus or sweat. There is more, the increased chloride inside the gland would absorb sodium because of the different reasons, difference in electrical charge, etc. So that's one mechanism, and as a result, absorption of water followed by increased concentration with increased absorption of water, and then thickening of the mucus in different spaces. But it's not always, in all cases, possible to exactly translate cellular, molecular abnormality into clinical presentation, why this causes that, or there are other theories as well, but let's move on.
Okay, what specific kinds of therapy is there for cystic fibrosis?
Besides antibiotic therapy, or if there is diabetes, to control diabetes, or for example there is infertility also in men, which is not a bad thing given that its outcome is bad. There is also gene therapy has been attempted, because that's very sophisticated, not successfully at just research level. What they do, the goal is to give a normal copy of the gene injected using viral vectors into the body, so the body can produce the normal protein. By the way, back to the pathogenesis, what happens is that the protein that's the product of the gene, it's a protein that gets affected by one amino acid being replaced by something else, an abnormal structure, and that can happen in different parts of the protein chain, and that's why there's about 1,000 mutations. As a result, one way, at least theoretically, is to give a normal copy of the gene, which needs to be injected through a viral vector. It has been attempted but unsuccessful, so that's something in the horizon. Other than that, supportive and preventive measures. There is no cure or no more specific treatment.
Would a lung transplant, for example, help?
Oh, very good. Yes, that's also one of the available treatments if the lung is not treatable. So basically, fibrosis, by the way, the term fibrosis comes from scar tissue all over gradually because of the damage, chronic damage. So lung transplant remains a possibility to prevent that.
Okay, thank you very much for your time.
No more questions?
Nope, that's it.
Okay, thank you.
Alright, see you.